Hi and welcome to another video for high-yield USMLE questions. On today's video, we'll focus on microbiology. So let's start with the first question. A 30-year-old farmer comes to the emergency department with difficulty opening his mouth for the past several hours. His wife reports that he sustained a deep puncture wound on his leg from a rusty nail while working in the fields. He has no known medical conditions and is uncertain about his last vaccination. Which of the following is the most likely mechanism of the toxin responsible for this man's condition? Now, given the history of trauma and uncertain vaccination status, we should immediately suspect tetanus, a disease which is caused by Clostridium tetani. Now, let's carefully look at the options which are given for this question. A. Antagonizes muscarinic acetylcholine receptors. B. Antagonizes nicotinic acetylcholine receptors. C. Blocks presynaptic release of acetylcholine. D. Blocks presynaptic release of gamma aminobutyric acid. E. Causes demyelination. The correct option here would be D. Blocks presynaptic release of gamma aminobutyric acid. This is because tetanospasmin, which is the toxin produced by Clostridium tetani, prevents the release of inhibitory neurotransmitters, specifically gamma aminobutyric acid and glycine. Without gamma aminobutyric acid and glycine, the motor neurons are overactive, causing sustained muscle contractions, which leads to locked jaw, a rigid smile, and severe back arching due to muscle rigidity. Since this mechanism directly explains the patient's symptom, this is the correct answer. Let's analyze why the other options are incorrect. Option A is incorrect because muscarinic receptors are part of the parasympathetic nervous system and they control functions such as the heart rate, digestion, and glandular secretions. Antagonism of these receptors would cause dry mouth, increased heart rate, and reduced gut motility, but not muscle rigidity or spasms. Since tetanus involves uncontrolled muscle contraction, this option is incorrect. Option B is also incorrect because nicotinic receptors are found at the neuromuscular junctions and their blockade leads to flaccid paralysis. Option C is incorrect because blocking acetylcholine release at the neuromuscular junction would also result in flaccid paralysis as seen in botulinum toxin poisoning. And option E is incorrect because tetanus does not involve direct damage to the myelin, but rather it's a neurotransmitter dysfunction. So this option is incorrect as well. In a routine prenatal care setting, it is recommended that all pregnant women undergo screening for vaginal and rectal colonization with group B streptococci between 35 to 37 weeks of gestation. What characteristics does a positive culture for group B streptococci display? Now, group B streptococci is a major cause of meningitis and sepsis in newborns, and in clinical practice, correctly identifying group B streptococci is essential for preventing neonatal infections. In order to answer this question effectively, we need to understand the hemolytic and biochemical properties of different streptococcal species. The options which are provided here are A. Alpha hemolytic and bile resistant, B. Alpha hemolytic and optocin sensitive, C. Beta hemolytic and bacitracin sensitive, D. Beta hemolytic and CAMP positive, E. Gamma hemolytic and salt tolerant. The correct option here would be D. Beta hemolytic and CAMP positive, which are characteristic of group B streptococci. Beta hemolytic refers to the complete lysis of red blood cells, forming a clear zone around bacterial colonies on blood agar. And a CAMP test also is a diagnostic test where group B streptococci, they enhance the hemolysis of Staphylococcus aureus, forming an arrowhead-shaped zone of enhanced hemolysis as illustrated in the image provided on the right side of the screen. Before we go through the other options and analyze why they are incorrect, I would like to talk about the different types of hemolysis, which is alpha, beta, and gamma, since they are mentioned in all the options. Alpha hemolysis refers to partial hemolysis of red blood cells, which gives a greenish discoloration on blood agar. And beta hemolysis refers to complete lysis of red blood cells, forming a clear zone around bacterial colonies on blood agar. And gamma hemolysis refers to a lack of hemolysis, meaning the bacteria do not cause visible red blood cell destruction on blood agar. Now let's have a look at why the other options are incorrect. Option A, alpha hemolytic and bile resistant, they are characteristic of viridins streptococci. Option B, alpha hemolytic and optogen sensitive, they are characteristic of Streptococcus pneumonia. Option C, beta hemolytic and bacitracin sensitive, they are characteristic of group A streptococci. And option E, gamma hemolytic and salt tolerant, they are characteristic of enterococci.